Sandra all the time is here with the cold hard truth. She's the ears and the eyes for me and you. Every day, everyone want to hear from Sandra. And every time on the air, she's getting better. Tell your sister, tell your brother, tell your mama, call Sandra in the morning and in the evening. They always calling Sandra. And when they start fighting, they calling Sandra. And
That's right, folks. Everyone is telling their mama about the cold hard truth. Welcome to another episode with more truth telling, more problem solving, and of course, more tea spilling than ever before. Sit back, students, grab your tea and turn up the volume because class is now in session. Call in at 936-2626 because your voice matters. Share your opinion on issues that matter the most to you. All right, folks, happy Tuesday. Hope that everyone is having a fantastic week so far. Early week, we got lots to cover today. So we're absolutely tickled pink to have another segment of Medical Rundown Tuesday. So we want to welcome all of our Instagram listeners. We've got YouTube and Facebook, of course, and also Bobo 103.1 FM. So good morning, one, and good morning, all. Hope that you guys are having a fantastic day. I'm going to go ahead and send out the links. We're up nice and early this morning, like we like to do it here on the Cold Hard Truth. So very, very important topic today when we talk about, I think all of them are important topics, really, when we're talking about our health and wellness and, things that we need to consider and how to make our lives better. Let's just be quite frank and honest here. Health City comes on here every single week and they give you tips and information that is delivered in such a way that you can take control of your health and well-being. And that's extremely important because there's so much that we can do. I remember a segment where Dr. Shetty at the opening there of the facility in Camana Bay, I got an opportunity to sit down with him one-on-one. First time, by the way. He's such an interesting person, but very, very passionate about people taking control of their health, right? That this is a journey. This is your life. And so the most important thing that we all can do is to try to live it as meaningful and healthy as possible. And anything that we are able to do ourselves to increase the opportunities of living healthier, making sure that you're monitoring your health, you're getting exercise. Yes, you have to know your numbers because all of that stuff is very, very important when it comes to, offsetting or sometimes even preventing a lot of lifestyle diseases. So that's what I love really about these segments here. Every single week, we have an opportunity to sit down and talk with medical professionals so that you can have some good takeaways. So today is a very, very important topic because I know, quite frankly, that, heart disease and related cardiac issues is something that plagues a lot of us. Just a few days ago, we lost some people to, basically heart attacks. And so this one you definitely want to pay attention to, folks. Let's go ahead and welcome into the studio Shamari Scott, who's a regular figure here every single Tuesday, just about, as the Chief Business Officer at Health City. Good morning, Senor Shamari. How are you?
Good morning, Sandy. How are you doing today?
Yes, I'm doing very well. Thank you so much. Good to
Well,
see you.
yeah, well, so you see, I tell you, I've been having IT challenges
Yeah, that's
the
okay.
past few weeks, So this morning I tried to log into my email, obviously, to get to the link. And sure enough,
Mhm.
it's asking for some double authentication, which is never asked for before. So I got locked out of my email. So I'm
Yeah.
actually streaming from my phone, but I'm trying to find an angle that it works, but it's not working right now. So
Yeah,
as of
that's
right now, it will be a picture of me. But
yeah, looking good, looking good. And
yeah, so that was the day of voting. So I was like, you know what, it's still fresh. So let me put on the picture of the day to go vote. So
yeah,
all
it's
good.
looking good in your key man shirt there. I like it. I like it.
But no, you're so right that obviously Health City from a long time decided that at least once a week until we needed to have a break, whether it's over the summer or over the Christmas, we always want to come to the Cayman Islands community just to outline different aspects of health, whether it's preventative and or how we could help on the back end. And at times, as our departments grew and as we have more and more segmentation within Health City from a physician specialty perspective, at times we forget about our core, right?
Mm,
And some of the core few specialties that we started with day one, and one of them was the cardiac care. And obviously, when we first started, we, for the most part, would have really been pushing the fact that persons didn't need to travel overseas.
mhm,
You would have heard from Dr. Ravi and Dr. Benoit previously, where heart is time is muscle, which is heart muscle, and the quicker you get to a facility that can help you, it will be better for you from a saving of a life perspective as well as the quality of life moving forward. So we thought, especially because we would have our anniversary
mhm,
is actually upon us again, that we
mm,
would bring in Dr. Benoit, who is our clinical director, our
mhm,
cardiothoracic surgeon, our leader at Health City, who has close to 3 decades of experience. He's done over 6,000 procedures and surgeries, which typically many cardiac surgeons will retire without doing that number. He does
mhm,
complex cases, aortic surgeries. We're also today going to touch on ECMO, which a lot of people may not know what that is, but that definitely is a lifesaver. We look forward to having Dr. Benoit on, as well as to seeing one or two videos that actually outline the expertise that we have within Health City as it comes to cardiac care. So we're excited to bring Dr. Benoit to the forefront again today.
mhm. Wonderful. Well, let's go ahead and welcome the esteemed Dr. Benoit into the program. Good morning, Dr. Benoit. How are you?
Good morning, Sandy. I'm very good. Thank you. How are you?
Yes, it's so good to see you. I'm doing fantastic. Thank you so much. We are, I think, very, very privileged to have so many experts at Health City. And one of the ones that people always talk about, of course, is the cardiac team, because we know that health. There's so many different things from cancers to other health issues, but the heart. I feel like that's the central, component of everything that keeps everything going, and so incredibly important. And I feel just really honored to have the level of expertise that we have at Health City when it comes to cardiac issues. And so this morning we're going to be talking about the Cardiac Science Center of Excellence and what that is. And I see already we have a number of people paying attention to this very, very important discussion here this morning. So, Dr. Benoit, health is wealth. I know this is something that you yourself is a proponent of. So let's talk a little bit about as an overview of why it's so important for people to take charge of their health.
Yeah, Sandy. Today I'll be a little bit of concentrating on this cardiac sciences and the why it is a center of excellence.
Mm-hmm.
See, before that, I'll tell you what do we have on the island when we say the cardiac sciences. What all things part of that? See, one is the infrastructure and equipments, and other is the manpower. What do we have? And
Mm-hmm.
then we will understand why we are calling this a center of excellence and why we are not inferior to or at par with any best cardiac centers in this part of the world.
Mm-hmm.
So we know we have now two hospitals, we have two cath labs, and out of that one is a hybrid cath lab. Hybrid cath lab means we can do the catheterization procedures as well as surgery, because some of these procedures will need cardiologists and cardiac surgeons together working at the same time to make the outcome much better. So we can see the images at the same time we can do the surgery. So that is a very unique, and this is the only one in the Caribbean. Leave that. So
Mm-hmm.
that is the two facilities, and we have three cardiologists. Out of that, one is Dr. Ravi Kishore. Everybody, no need to introduce anything, but he is a electrophysiologist. So that means it is gone to one more specialization. You can say the super specialization of subspecialty.
Mm-hmm.
Uh, he is here for the last 11 years. He does all these heart rhythm related problems. We have another adult interventional cardiologist, and we have one pediatric interventional cardiologist, and we have two cardiac surgeons. Apart from me, Dr. Sridhar, he is other cardiac surgeon with more than 10 years of experience. Plus, we have two uh, uh, cath lab technicians,
Mm-hmm.
and then specialized nurses for the cath lab, and for dedicated ICU is there for cardiac sciences. For patients comes with a heart attack or post cardiac surgery, we have a dedicated ICU for that.
Mm-hmm.
Then coming to the some high end equipments, what I can say in cardiology, we have these two cath labs. We know the Philips, very high end. We can do anything and everything related to heart, whether it is adult or pediatric. The high end, the we call this intravascular ultrasound with the coronary arteries. If the heart attack is there, if there is any, we can see the vessel, how much is the obstruction, how much is the block, it's significant, how much. I mean, we can see everything real time before taking a decision on the intervention on that. And for pediatric cardiologist, we have all those devices to close the defects in the hearts of these small kids without going for surgery. I mean, not for all defects, but
Mm-hmm.
like the small holes in the, we call it ASD or VSD or PDA, or some of this valve to open up. So we have all those devices and equipments to treat this pediatric cardiology procedures.
Mm-hmm.
And then comes to cardiac surgery. It's much easier for me to tell that what we do not have, that is a cardiac transplant. Rest everything we do in cardiac surgery or pediatrics or adults, you can tell whether it's aortic surgery or pulmonary endarterectomy. What I am telling is the very very high end procedures, ECMO or this artificial pumps, of that all varieties, like from the lower end of the spectrum of these artificial supports that we have, is that balloon pump to ECMO to Centrimac to LVAD. So all those things available in the world we have. So why I told you that, since we in Cayman, no need to think about we have something is not there, whether it
Mm-hmm.
is instruments, equipments, or expertise to treat any cardiac ailments for somebody as newborn, I mean 1 day old, to whatever age
Mm-hmm.
population, whether they need. Because some of these in 90s and all that, when it comes to some procedures like valves, like aortic valve, they may
Mm-hmm.
not be in a fit physical condition to go for an open heart surgery. Then we have this something called TAVI. No need to cut anywhere in the chest. We can put through the groin one catheter and put the valve and come back. Next day they are going
Mm-hmm.
home. So
Wow.
all those things we have, and we are seeing now uh, the patients coming from across the region for
Mm-hmm.
these high end procedures. Okay, when we need some simple valves or simple holes, okay, they may be going locally or near some other place. Now what we see is of late, the complex procedures, they are reaching out to us. Like right now we have one child, just 5 pounds,
Mm-hmm.
weighing, and came in from Trinidad on an air ambulance just 1 week after birth. and
Wow.
we did a very complex surgery. It's called arterial switch because the child's the aorta. I mean, I'll tell you a little bit of the
Mhm.
medical terms. The two main pipes that comes from the heart are interposition. So we have to cut these arteries and put it into the normal position, and the coronary arteries we have to put it into the again into the right one. So it's very
Uh-huh.
complex. The child is recovering very well, and maybe in a week's time, child will be going home.
Mm.
Similarly, in from Barbados, we got a call from a visitor from UK. Suddenly developed uh, very aggressive form of pneumonia. Both lungs were involved, and the oxygen level went down like in 60s, and she was kind of the organ shut down, liver shut down, kidney shut down.
Mm.
Nothing is working. So in a panic, they called whether we can do. So our team from here went on an air ambulance, instituted that ECMO in that hospital, and brought her back here. She's going to UK today, walking. So these are the
Mhm.
conditions, complex situations, whether it is adult, pediatric, or whatever you
Mhm.
say in heart. And today I can say maybe in a couple of hours, one
Mhm.
patient is coming from Bermuda for an heart attack. Dr. Ravi Kishore is going to treat that patient. So we
Mhm.
are seeing every day, every other day, patients are coming from across the region for whether
Mhm.
it is pediatric, adults, heart attack, or aortic surgery, or valves.
Mhm.
This is what we have reached over last decade.
Mm.
I
I
talked a
mean,
lot.
it's Dr. Benoit, I think it's a real testament to what has been accomplished here to have such a relatively small jurisdiction offer such a wide range of services, but particularly today, we're looking at the key services falling under the cardiac sciences, science of excellence. I mean, not just adults, but pediatrics, babies, children, covering everyone essentially. So you've just given us some examples of some of the more complex procedures that can be performed right here. And then you've got people, Dr. Benoit, you talked about someone coming in this morning from overseas. So there are people who are choosing, although they could just as well, or perhaps easier flight to get to the U.S. because of the level of care and an affordable price point. They're choosing to come to Cayman.
Yeah. So
Wow.
that's what. See, the price alone will not attract patients because they should see
Uh-huh.
the great clinical outcome. So
Right.
unless these price and outcomes go hand in hand,
Mm.
it's not going to give the trust or confidence of the people. So that's what we have achieved, and we are very much concentrated on. Dr. Dhruva is there. Always look at the clinical outcomes. His eyes are there everywhere. If there is one patient gets some extra infection, he'll be there all over, bring the sky down. So we have Dr. Archida is their infection control team. So we have that people who always look at the clinical outcomes constantly, because
Mm.
unless whatever we said, and then individuals, how much ever we care, that watchdog effect will be there. Unless somebody is watching, always, however good we are individually, if somebody is watching, we will always a little bit of careful. So that is there. And obviously that cost advantage, definitely Shamari will, I always call him Dr. Shamari, sorry for that. He will tell about that cost advantage for all these people, why they are
Mm.
looking at whether it's cancer care, whether it is neurology, orthopedics,
Mhm.
any of these specialties.
Mhm. Fantastic. All right. So we do have some additional recent milestones, really, in terms of life-saving intervention. So, you've already mentioned some of these, Dr. Benoit. We have a very, very good video that I think we can queue up now as well. Uh-oh. Let me see what's going on here. The video should start. It's taking a little second. So while that's loading, Dr. Benoit, can
Okay.
you talk a little bit about some of the additional life-saving interventions?
Yes, I today I want to concentrate on a couple of things, especially this ECMO services that we have, because this lot of awareness is needed not only for the public, it's mainly for the physicians, because among physicians there is not much awareness about this ECMO, how life saving it is. Because see, anything, any situation for the heart or lungs, if suddenly deteriorating, we can institute on this machine, and in that time we can find out what is wrong, and this will give, at least the patient will not die. We have enough time to assess, evaluate, and treat. So if it is a very severe pneumonia, usually mild pneumonia can be treated at home. If it is a little bit more severe, get admitted and maybe intravenous antibiotics. Little bit more severe, they might need on ventilator support to keep the oxygen level. But there is percentage of population with this pneumonia, they may not be sustainable even with this ventilator. Even 100% oxygen you give also, because if both the lungs are severely affected, there is no place in the lungs to give adequate oxygen to the blood. So that is the stage when we should intervene with this ECMO. So otherwise what happens, slowly the low oxygen, all the organs in the body, including brain, liver, kidney, everything will be shut down, and in a couple of days or in a few days they will succumb to this situation.
Mm-hmm.
Similarly for the heart, see, severe heart attack means heart is not able to pump. The heart pumping is so much down. So they are going to die in a few hours. So immediately you can institute this ECMO stable. I mean, the machine will work like an artificial heart and artificial lungs. It will give pump blood to the entire body. It will give oxygen. It will remove carbon dioxide. So it's like a heart lung machine.
Oh, wow.
So we have three of these ECMO machines. One is transport ECMO. It's a very like most advanced, like 10 kilogram. We can take it to anywhere in the other countries or other hospitals, and we have a very very good team. We have two teams for this actually ECMO
Mm-hmm.
retrieval. We have the two perfusion scientists. Always they call it, they are the unsung heroes, because they are always there behind for either cardiology or cardiac surgery when it comes to these advanced machines, whether it is heart lung machines, whether it is ECMO. And it is very we have two of them actually, so very very experienced perfusion scientists. So all this matters, because when it comes to these advanced procedures, it is not
Mm-hmm.
surgeon or cardiologist or anesthetist. It's a big team is involved, very experienced ICU nurses, very experienced anesthesiologists, and intensive care doctors, even physiotherapy, dietitian,
Mm-hmm.
all this team involves, because all this matters. Whether the nutrition, we do not consider much, but in this scenario, when somebody is going to be on these advanced machines on feeding, so their immunity, so the nutrition is very important, especially when it comes to the small kids with 5 pounds and all that. Their
Mm-hmm.
two feeds matters a lot actually. So we have the entire team along with this all these advanced equipments and instruments. This what makes difference. So why I told about this ECMO is,
Mm-hmm.
even I am not seeing that much of awareness among the medical community of the island and live
Mm-hmm.
along in the region. Now I see, because why this Barbados come is in the month of January, they want, it's a similar incident. They wanted to shift a patient with this advanced pneumonia to United States, because they
Mm-hmm.
did not know about our capability of this ECMO, but somehow they could not transfer the patient to United States. Then they came to know about Health City, so reached out. We again went there. This is in the month of January. So this was again another visitor to Barbados from the United Kingdom. And the patient came here. He was on ECMO for 11 days and went home. He is recovering very well. He needs a little bit of cardiac rehabilitation. That's what's going on. But he is absolutely fine now. So they came to know, because of that experience in Barbados, this patient, when it happened, immediately they contacted us and we went there and instituted ECMO there, came here. So other islands are slowly understanding about this. Bahamas, we retrieved one patient around 6 months ago. Similarly, I think I mentioned to you that 41-year-old young doctor who had a cardiac arrest there while working in the hospital. So we again instituted on ECMO and brought her here, and we put her on this LVAD, left ventricular assist device, because her heart was so weak. So she started practice last month. She sent her video that she started practice again with the LVAD in. So these are the advances that we have, advanced technology that we have, and this is what the difference that is making to the patients. We have 5 patients on the island on LVAD now, and longest surviving is 8 and almost 9 years. By this July, he will be on this LVAD for 5 years. He came to the hospital 9 years ago, almost dead. Now he's on actually, and we offered him, actually, if you want, you can go for transplant. He told, I'm absolutely fine. I do not want any other treatment. So 9 years he is on. So this is what we are giving to the patients, their life, quality of life, and that's very important, the quality. See, if you do all this advanced technology and if you have bedridden and you do not have a quality of life, no point in doing all those things. He is living like a normal person, and all these 5 patients we have on island, and extended life for their family, for their children, everybody is a big thing actually. So these are the difference we are making for the patients, for the family, for the society, and for the country here, and for the region, Sandy.
Yes. All right. We've got the video ready, and another testimonial here, really, from people whose lives have been impacted in a real way.
I is a lonely sandfly sitting upon a leaf upon a sandy island surrounded by a reef. Things are really slow here sitting upon this leaf. Not a soul for talk to. That's my major beef. There ain't no beef here lying on the beach.
My name is Paul De Freitas. I kind of have 3 jobs. One of them is the theatre manager of the Prospect Playhouse, which is the playhouse belonging to the Cayman Drama Society. That is a volunteer activity that I've been doing since 2010. When one talks of theatre, you're talking about family. Earlier today, there were ladies here learning how to put together the lights for a fairly complicated show. And it was like talking to family, like talking to a sister. I'm a pretty active person. In other words, at the theatre, I build sets that are 10 feet tall with the help of Peter Passold and Bill Mervyn and other members of the Theatre Management Committee. So it was a little bit of a surprise to me when I wanted to take our dog Bugsy for a walk. I got up and went inside to basically put on shirts and other things that one needs to be out walking in public, and suddenly felt these bands across my chest. I do have measuring equipment at home, so I quickly put on a device onto my arm and realized that my blood pressure was 225 systolic. My wife, Fayanne, basically said, okay, you're not walking any dog. We are going straight over to Health City. I'm very lucky in that Health City is only 500 yards away. That is Health City East End. They gave me a quick test on arrival at Health City, and within seconds it was very clear that I was not going to be leaving there that night.
The surgery was a bit difficult because of all these procedures and with the background comorbidities, but everything went well. Surgery took around 6 hours. He was in the ICU for a couple of days and discharged home soon. Even though with the whole comorbidities that he had, with the plan that we had in mind, we executed very well. We took both the arteries from both sides of the breastbone. It's called total arterial revascularization with both internal thoracic arteries. The advantage of that is more than 90% of these bypasses will be patent even after 30 years of the surgery. So very, very unlikely that he will have another intervention for his coronary artery disease.
The whole experience at Health City brings back that word family. The nurses, the kitchen staff, the doctors. To them, I was just another family member. I would just like to express my profound gratitude to all of the staff who gave so much of their time making sure that this naughty boy behaved himself and got better very, very quickly, and is now comfortably back at the Prospect Playhouse, teaching, lighting, and building sets again. My heart is in the best place it's been in a long time. I sing a song of bees and fleas and mozzies in the night. I tell him how there ain't none here, and that it's only me, and that I'd be his friend for life right here beside the sea.
Wow. Yet another inspirational testimonial. Dr. Benoit, when you hear people express, and I must say, Shamari, you guys do an amazing job with these videos. I always get goosebumps whenever I listen to your videos and how people express their stories and how you put it together. But Dr. Benoit, when you hear people talk about these life-changing events, does it ever get, you do these surgeries day in and day out, and I suppose maybe it becomes routine to you, but do you get overwhelmed? Like I'm sitting here thinking, this is such an amazing story. You've saved his life, and his wife and his family get to continue to enjoy him for many, many more years. Does it sink in sometimes what you're actually doing and your entire team there at Health City?
So, Sandy, it's a very good question. Even of now almost 29 years doing cardiac surgery, even every patient is a new patient, and the experience is a new experience. And when these patients comes and when they come for follow-up, hug you and express their gratitude, definitely this really will overwhelm the feeling of the satisfaction. We have done something for them and their family. And something that is, I don't know how many of other doctors or other specialty doctors will get this. I do get videos from across this region, and even from India, even now, the birthdays of kids especially. Every birthday they will send a video of their celebrating their video on that day. They will remember not only me, our team. They'll send to our team. So this is what make us. I mean, what else you need? Every other day you get some videos, some messages from people across the globe. Okay, my child is doing good thanks to you and your team. My father is doing good. He is healthy. You don't need anything more in life to move on. This is the most important motivation for us to do more and more, whether it is night or day or any time of the day. Very, very, very gratifying. But coming to this patient again, see, one more thing I wanted to explain here about our concept of heart team. See, this heart team concept was put forth by American Heart Association a few years ago, because now if there is a block, there are different ways of approaching that block. Whether you can do an angioplasty with stent, maybe multiple stents, whether it's a surgery or to do with medicines alone. See, if I am a surgeon, I will tend towards a surgery. If Dr. Ravi Kishore means he will tend towards going for a stent. So that is the reason this heart team concept is come. So this patient immediately after angiogram, Dr. Ravi Kishore called me. Come, we will see this angiogram. We'll decide what is the best option for him. So in the cath lab itself, we discussed, okay, he has multiple blocks. In the main one, the left main is a significant disease. Okay, he will be better with a surgery rather than angioplasty or stent. So from the moment the patient comes and diagnosed, we have that team approach. It is not that I feel he needs surgery or the cardiologist feel he needs angioplasty or stent. It is us deciding, okay, what is best for this patient. So every patient we are keeping in the center and looking at what is the best treatment for him to give not only the short-term outcome, for the long-term outcome. So when it comes to this patient, he told that, and I told he used both arteries from both sides of the breastbone. This is very, very important. Everybody should understand this total arterial revascularization using these arteries from both sides of the breastbone is a life-changing. Because if you have seen the scar on the legs, taken veins for this bypass operations, the veins usually around 50% of them will get blocked over a period of 10 years. But then they need either some intervention or some surgeries. But when we use this total arterial, even 90 to 93%, even after 30 years, they are patent. They will not need any intervention. So we do at Health City more than 75% of the bypass operations using these total arterial revascularization. When in US, it is still 15%. They are pushing, even American Heart Association is pushing the surgeons. It's technically demanding. It takes a little bit more time than usual and that little complex, but it gives a significantly different long-term outcome.
So, Dr. Benoit, I don't know if you want to give those percentages again, but in the US, 15% use that technique. And what percentage do we use at Health City?
75%. And if you take countries, Australia is the highest percentage, 45. Because these are all published data by American Heart Association, and our rate is more than 75%. It's very, because see, when it comes to these surgeries, we should not look at the short-term benefits. It's a long-term. It's very important to see. There is something now maybe we can talk actually maybe 2 minutes. This minimally invasive heart surgeries. It's coming up very well. And you have seen our videos that mitral valve, aortic valves, and even atrial septal defect holes and all that. We do the keyhole surgeries. Very good actually, because 6 centimeter cut, not cutting across the breastbone, through between the ribs. So cosmetically very good. Their stay in the hospital very good. Chance of blood transfusion is very less. Pain is very less. So very good outcome for these patients. But when it comes to this bypass surgery, this minimally invasive or keyhole surgery is there for maybe almost 2 decades. People are tending towards that, but I wanted to give a caution actually, because the published outcomes in the 2024 last year, the meta-analysis published, it say when it comes for coronary bypass surgery, the chances of, this is a meta-analysis of many the studies that was done, 70% of these patients are under revascularized. That means if they need if they have 4 blocks and need 4 bypasses, it is done maybe 2 or 1, leaving the other 1 or 2 without bypass. And so it is the 2024 published data, and 40% of those who have undergone this keyhole bypass surgery had significant angina, because they have still the chest pain. So we have to see whatever these advances happening in this any field of the healthcare, we should always look at, see, especially when it comes for the cardiac surgery, it is not the cosmetics alone, it is the outcome also. So, I mean, it's very important when you are going to have another intervention, or when you are going, if you are worried about another heart attack, whatever you have done is not appropriate. So I wanted to mention this here, because that hype of this keyhole surgery for bypass surgery should be seen with a little bit of caution. I'm not telling it is not good or it is bad, but the published data shows some concern about that. But otherwise, valve surgeries and all that, it's no difference, absolutely, or it's better actually, if you ask. Yeah.
Wow.
So I just wanted to mention about
Yes.
when it came for this Paul's testimonial. Very good. And as I mentioned, he will not have any intervention for at least 25, 30 years.
Wow.
For sure.
Very good. Well, Shamari, let's bring it home and talk about the impact of the Cardiac Sciences Center of Excellence, not just regionally, but internationally.
No, definitely, Sandy. And my apologies. You'll see that I changed rooms. I'm not giving a a house tour. I'm having, so first the double authentication issue, but our IT team is so good that while I was on with you and I had the camera off, I was
They
able to
resolved
get
it.
that done.
Yes.
And then sure enough, it was my issue at home. The internet was spotty where I was, so I had to relocate and come here. But I wasn't sure if Dr. Benoit actually mentioned it, but when he was talking about the fact that we were traveling to other countries to administer ECMO in order to bring those critical patients to us, I think we are the only facility, and remind me if I'm wrong, Dr. Benoit, that actually is able to provide travel with the ECMO machine, with the air ambulance, to go pick patients up within the Caribbean, to actually bring them back to the facility in order to administer the care. Because obviously, if you weren't able to get to them with the ECMO machine, then the chances of the patient survival is minimal. So we're not only do we have the capabilities within Health City, we have now partnered with an air ambulance company specifically, one of them, that we're able to take our ECMO machine, our portable ECMO machine, and travel to other parts to take critically ill patients from that entity overseas and bring them to Health City. And I think as we continuously expand our services, we start to take the expertise and what we're doing for granted. and not realizing not only the impact, but the highest level of quality it takes. One, only a few centers have ECMO, which Dr. Benoit would have explained. But two, only a few centers have the survival rate that we have with ECMO. And I wasn't sure because I was going in and out if Dr. Benoit, you went over the stats of the survival from an ECMO perspective. Did you, Dr. Benoit?
No, I did not. I did not mention that.
So right while I'm here, if you could just give the stats to show that level of expertise as well.
Yeah. So we are the only, again, I am telling some of those things, only ELSO accredited centers in the country. ELSO is extracorporeal life support organization based in United States. So they will always look at the outcomes, because one patient we are instituting ECMO, we have to put the details, we have to give to them how many days, what type of ECMO we instituted, and if there is any complication happen during the time, what is the outcome, survival, all those things. So actually we are going to publish our data, because we have done almost 75 so far, this ECMOs between adult and pediatric. 68% survival going home after ECMO. This is, see, when I say 68%, don't think, oh, it's only that much. Don't think like that, because this is not an elective surgery. This is a patient who have either had a cardiac arrest or multiple organ failure. The only next their chance is death. So these are bringing them from death, and 68% of them went home after ECMO. This is one of the best results, because these results are there available ELSO registry. You can see what is the best outcome of ECMO in the best so-called hospitals. So we are at par with this outcome of this ECMO, what we are doing.
And then on top of that, Sandy, not only are we one of the top facilities when it comes to the ECMO and the survival rates, but we are now providing a remote option where we can go and travel elsewhere that don't have the facilities, and those persons most definitely would perish, and to bring them from death's doorstep to the Cayman Islands in order to save them as well. So just, you know, outside of everything that we're doing, obviously from an economic impact perspective locally, but the lives saved locally, and outside of that, the lives saved from overseas, that we're bringing in air ambulances, bringing in ECMO patients, and then even elective. Obviously, people choose to fly here to get their surgeries, whether they're from Canada for orthopedics, Caribbean, for the whole range of different surgeries. We have individuals coming from Central America. We, at some point in time, I think we need to have that. I wasn't sure if we ever played that video on here, but it is the general in charge of the armed forces in Honduras that had a significant
I remember seeing that one.
And this is before he was going to be inaugurated, or whatever the term is, as the lead for the armed services. He had that massive heart attack. They got him through air ambulance here to us at Hell City, and it was a serious case. And Dr. Benoit came through to the point where, after he survived, had a great recovery, and went back to Honduras to actually become the lead general. Dr. Benoit was the guest of honor in Honduras for that gentleman. So it just shows you that these individuals had choices, that they could have gone to the US, but because they understand the capability of Dr. Benoit and the entire cardiac team, that they're choosing us versus the US, knowing the level of expertise that Dr. Benoit and team has as well.
Yes. And folks, again, I mean, you can read up on this ECMO, life support system, and it's really amazing. And it's just absolutely fascinating what modern medicine is able to do. And once again, here in the Cayman Islands, we have so many available options, the best of the best right here at Health City Cayman Islands. So this is a fantastic, just skill set, and medical and technological advances have all sort of converged together. Miss Beverly says, great job to the medical team in Health City. Amjad gives Shamari a big shout out. Says Shamari is a good Caymanian who helps everyone in Health City. Thank you so much, Shamari. Good morning to Oli. So good to see you here. Joseph also joining us just now as well. So we've got close to 300 people on the live stream, and they're awfully quiet today, which means that they're listening and they're taking a lot of mental notes. So folks, this Center of excellence for cardiac sciences right here at Camana Bay, and they continue to expand their services and continue to do life-saving procedures impacting everyone, I think, that we have here in the Cayman Islands. I've heard so many stories of people who will say, oh my gosh, they really saved my aunt's life, my mom, my dad. So many people are grateful for this regional center for cardiac excellence, which of course boosts, not just saves lives, but also helps to boost medical tourism and has a lot of trickle down effect as well. So will you have, Dr. Benoit, one of the questions that people often have now, because you have the center located, the additional Health City Cayman Islands at Camana Bay, will they have the same complementary services and options for the cardiac services?
Yes, Sandy, exactly the same. So we have the same cath lab, we have the ICU, we have the anesthesiologist 24/7, intensivist 24/7. All the staff are there.
Fantastic.
And we have this cardiologist, 3 cardiologists and 2 surgeons. So we have manpower, we have all the infrastructure, equipments, everything available in both places.
Well, that's fantastic, because, people on that side of the island need you just as much. So there you have it. Thank you so much. Another wonderful and educational segment here on our Medical Rundown Tuesday. Again, cardiac sciences and what all the wonderful things that they're doing there at Health City Cayman Islands. And, just remind people, Dr. Benoit, what they can do to have a better outcome when it comes to cardiac health, because there is a lot of lifestyle changes that if we're committed to living longer and better lives with less medical intervention, you're there certainly if we need it, but how do we avoid, we've got a phone call. How do we avoid, is my question, seeing you for cardiac events? But let's take this caller first. Good morning, caller. Welcome to the program.
Morning.
Morning.
I wonder if Dr. Benoit could tell us the difference between a heart attack and a cardiac arrest, and what key pieces of information we should understand about both of them.
Yes, good question. Thank you so much, Denny.
Sure. So heart attack means, when the blood supply to the heart muscles are suddenly stopped because of the block, you will get that severe pain. Sometimes you may not get pain also, but you will have all the changes that is expected in a heart attack, but your heart is still working. Heart is still pumping blood. When you say cardiac arrest or heart arrest, means heart stopped pumping. That means, in a few seconds you are going to die. Cardiac arrest, you need a resuscitation in cardiac arrest, but in a heart attack you don't need resuscitation. You have to treat that heart attack. It's a big difference is there. Heart attack and this cardiac arrest may be due to different reasons also. No need that cardiac heart attack can lead to cardiac arrest, but cardiac arrest can be due to many other factors. So it's a totally different actually.
Very interesting. All right, so let's talk now about the things that we can do on an individual basis. Every single day, those little decisions that we make help us to have a better health outcome.
So, Sandy, this is very important actually, you asked towards the end, because all this heart attack or cerebrovascular accidents, whether it is heart or brain, both we can detect early and prevent. this is such a important topic we have to discuss and disseminate among the public, because see, after 40 years, and especially if you have the risk factors, when I say risk factors, like any family history of heart attack, or in diabetes, high blood pressure, or cholesterol is high. So especially when you have the risk factors after 40, you are predisposed to have these blocks in the coronary arteries. And now, directly and indirectly, you can detect this. See, when I say indirectly, there are many tests are there. So whether you can do ECG, echo, stress test, all those things will tell you to some extent. But it will not completely rule out you do not have a block. But if that is positive, there is you can go to the next level of either angiogram or whatever these things. But there are something like a CT angiogram, that put some dye and go to the CT room. 15 minutes, you will see the entire coronary arteries, and you can find out if there is any block. This is very important. Everybody should go through this preventative care, because completely avoidable situation, whether it is stroke or heart attack, you can see this. And the sad thing is, you may feel good without any symptoms before, and you may be walking, doing every job and exercise, and that doesn't mean that you do not have a block in the coronary arteries. So your external appearance or feeling doesn't have any correlation with what exactly is happening inside the body. So that is the reason we should have, because we are listening every other day, somebody while working out in the gym, some suddenly collapsed and died. Somebody never had any symptoms, suddenly collapsed and died. So these are all we can be avoided if you have done a checkup, appropriate checkup, and see a cardiologist.
Right.
So
let me just ask you another question. This is sort of a technical one in a way. I can't remember the type of stroke, but someone was saying that there is like a full body scan that you can do, right? And so this woman who's in health and fitness and wellness, otherwise looks fantastic, found out that she actually has this, it's almost like a pending, potentially, blood vessel, that once they see it there, they know that it's a low percentage, maybe 3 or 4% of the people will have that burst, and then that's a stroke on the brain. What is that called? Do you know?
it's
Which
called
one?
aneurysm. It's a
Yeah, I think it was a
small
specific
blood vessels.
trait, but yeah. Do you recommend that people go and do these scans to see because once that bursts, then obviously you're in trouble, but do you recommend something like that?
No, not Sandy. See, that is because first of all, this incidence of this is very, very low, and doing this whole body CT scan for this is not recommended. It is not advised also. But these patients usually will have some symptoms before, actually some headache or something, and accelerated high blood pressure, all those things. So right time they should go to the right doctor. Once they evaluate, they will tell, actually, okay, we have suspicion of this, you should have a either CT or MRI, then you can detect early. These aneurysms are extremely low incidence.
Yes, because she was actually saying in her write-up, I forget her name now, but they saw it there, but she can't do anything about it. So now it's like something that's worrying her because she knows that it's there. But as you say, it's such a low incidence of it actually developing into stroke that I was thinking to myself, maybe the stress of knowing is more dangerous in that situation than anything else. But, this is why it's important to speak, folks, to the medical professionals, because, Dr. Benoit can assure you, right, if it's only a 3% chance of something ever happening, it's not worth the other maybe associated risk with trying to do a full body scan. And if you can get to, now we know, especially with stroke victims in particular, and even coronary events, if you can get to the medical teams as quickly as possible, that's why time is of the essence. If you can get to them as quickly as possible, your chances of not just surviving, but having a full recovery improves significantly. So fantastic, Dr. Benoit. We have Miss Dora Dixon here, says, I would like to say thanks to Dr. B. He saved my life in 2022. So again, so many people being added to that list of survivors who are incredibly fortunate to have had Dr. Benoit and his entire team there at Health City Cayman Islands and their services available to them. So Dr. Benoit, thank you so much. As always, I've been trying to, I know I'm supposed to go in soon to see Dr. Sandeep, and I have been trying to improve the diet. I've been trying to exercise a little bit. Everywhere I go, people say, you look like you've lost so much weight. I don't feel like it's a lot, but it's so interesting that people are definitely seeing a difference. And of course, I want to continue doing that. I love my pickleball, but even just simple things, walking and more wellness and exercise, again, being important and critical is watching what you put in your mouth to begin with.
So trying or doing, Sandy?
I am trying and doing.
Okay.
I'm not gonna say that we're there yet. I have my moments when I feel for a little treat here and there. But yes, some improvements have definitely been made. I'm definitely eating more greens, especially my salads, and yes, eating my broccoli first when I sit down to meal and so on. So we're making improvement.
No more fried breadfruit and
well, occasionally we might have it occasionally, but yeah. So small tweaks here and there, wearing the smart watches a little bit more, and just really making some changes, baby steps, but we're making some changes. So hopefully when I see Dr. Sandeep, he'll just tell me to keep going. We're going in a good direction.
That's good.
Yes. Well, thank you. Yes.
Yeah, definitely, Sandy. And so, I was actually going to say thank you for once again having us on. Thank you, Cayman Islands, for listening. But at the end of the day, we have patients from all over the world that are traveling specifically to see us at Health City. We have patients from Mongolia, Fiji, etc. From a pediatric perspective, we have patients all over the Caribbean, Central America, and even North America. As you would know, that the cruise lines are very particular. And we get quite a bit of cruise, not only the actual visitors, if they have an emergency that come to us, but from an elective perspective, the crew members, that one cruise line can have over 60,000 crew members. So there are, many ships and many employees, and we see a lion's share of those individuals coming to us as well. But, at times we don't remind people locally that at the end of the day, we're here. Some of the highest quality outcomes you'll have, which is why U.S. physicians and health systems, when they come, they marvel at our quality of outcomes. And we're an open book. We open up the hood. We allow them to look at everything, see everything that we're doing. And then obviously they ask the other questions that our physicians can answer in regard to how we're able to deliver the quality of outcomes we can. So just wanted to remind the local population as well as the resident population what we have here in the Cayman Islands and both locations, right? In Camana Bay and obviously in East End as well. So if you ever need an appointment, 640-4040 or info@healthcity.ky, or you can go on the app and search for the physician you'd like to see and also book from there as well.
Fantastic. Well, thank you both so much. Appreciate it.
Thank you.
Thank you,
Sandy.
Thank you, Dr. Benoit.
All right. Have a good day.
Thank you.
All right, folks. And don't forget CMR TV coming live online very, very soon. And we're going to have some very, very exciting, programming for you. And anyone who's interested, this is all about Caymanians and our community. So anyone, quite frankly, who is interested in becoming part of that journey, please reach out to me. 324-1612 is my personal number. And we're happy to discuss, how it's going to work and what we're looking for. In particular, we're looking for someone who has a passion for sports. So if you have a passion for sports and you're interested in getting involved on that front, please reach out to me, because we're going to have so much amazing fun here on the platform as we continue to expand into TV and having our own radio station at some point as well. All right, next segment coming up, we're going to have MRCU joining us for a little bit. They're going to be talking about, I bet I know what they're going to be talking about, probably mosquitoes, who have been making our lives very, very interesting recently. Kevin Watler in the house. Good morning, Kevin. How are you?
Good morning, Sandy. Good morning, Cayman Islands. I am doing very well. It's been very, very busy on my end, but that's what we're here for.
Yes. Well, I tell you what, I've definitely noticed over the last couple of weeks, the mosquito population has been out and about, walking Zeus. I feel them biting me all the time, all hours of the night and day, I swear. And I'm slapping them and trying to get them off of me. So tell us what's going on today.
Well, we're now in rainy season. That means we're also in mosquito season. Rainy season officially began in the Cayman Islands May, goes all the way through November. And with the rainy season, it means that we're going to have more standing water, and it means we're going to have more mosquitoes laying eggs in the standing water. And then we have to really step up our operations to be able to try to keep the numbers of mosquitoes as low as possible, so we could keep everyone comfortable. And this special week for the region, actually, because it is actually Caribbean Mosquito Week, and their focus is, if you've been following some of the news recently around the region, dengue is one of those, the mosquito-borne illness that is really affecting a lot of our neighbors. And so they're having a heavy focus on trying to reduce that from spreading throughout our region. Thankfully, here in Cayman, we do not have transmission of dengue. At the same time, we want to make sure that we don't want that to ever happen. So what we are asking people to do is their part, because this is not just the MRCU alone initiative. It has to be a community-wide initiative where we do what we call source reduction, which is at homes. Everyone has a part to play. They're going to have to, while we are out there in the field, doing yard inspections and taking away those sources, such as dumping your buckets, your anything that's holding water. We need everyone to walk their properties at least once a week and make sure that they're removing any potential for mosquitoes to lay their eggs. And I know also I just want to introduce someone that not everyone might be familiar with, but he's our Deputy Director of Operations, Chris New. He's in the backstage here. We could bring him on, and I don't know if he has anything to add on that.
Yep. Oops, sorry. There we go. Sure. Morning, Chris. How are you?
Good morning. Good morning. Thank you for having us on. Yeah, just to kind of reiterate what Kevin was saying, mosquito control is most effective when we do have community engagement. So our teams are out there even today as we speak, and doing home inspections and things like that. But when people can, empty those water containers, clean gutters, cover water containers where they might be collecting water. Those things go a long way to prevent the spread of dengue.
Yeah, I mean, listen, we know that mosquitoes obviously carry so many diseases that we have to be careful, when we have a resurgence of them during, as Kevin rightfully said, during the rainy season. So it's important that we remember some of the basic control elements, what we can do, around us if we see any standing water, other things that we need to be cognizant of. And I know that obviously MRCU has stepped up their part of the equation as well. I've seen the plane a lot of evenings now going out. And Kevin, tell us perhaps a little bit more about what the team has been doing. You actually showed a very interesting photo last week. I don't know if you have that handy. Maybe I can try and pull that up. of your team out in the fields, looking at mosquito populations, doing all the necessary sort of checks to see where they're increasing and where you need to then undertake some additional treatment as well. So there's a lot of them out there. Can we just say that?
Yes.
I'm going to pull up this picture because I was
you'll pull up the picture.
Yeah, I'm going to try to see if I can grab it really quickly here. But I'm like, oh my gosh, that's a lot of mosquitoes.
So while you're looking for the picture, yes, the last couple of weeks mosquito numbers have been a little elevated, and those are the black salt marsh mosquitoes. That's a mosquito that breeds in our mangroves and is mainly a nuisance mosquito. That's the mosquito we've been seeing over the past couple of weeks, coupled with the rain that we've had and plus some high tides. It just really allowed those mosquitoes to hatch off. As part of kind of a focus of Mosquito Awareness Week, that's more focused to a container breeder mosquito. Aedes aegypti is the name of that mosquito. This mosquito breeds in and around homes and lays their eggs in containers. So as the water kind of starts to evaporate out of container, it leaves a damp area around, and that's where that mosquito will come in and lay those eggs. And it just the eggs just lay there and wait for that next rain event to come, and then those eggs hatch off. And if you're seeing aegypti, it's a mosquito that's got black and white striped legs, and if you're seeing those around your home, they don't fly very far from where they hatch, maybe 300 yards. So if you're seeing them, it may be coming from your yard or your neighbor's yard or maybe one house over, so they're coming pretty close.
Right.
This picture here is
Wow.
Aedes tenurinus. That's
pretty wild.
This was not too long ago. We were out doing some trials, and they were really localized. This was a really localized issue, but this is pretty bad. This was probably what we would call, we do 100 plus bites per minute. And I don't even know how this person was standing there, letting them land on him like this. I know I would have been back in the truck. So.
Yeah, and this was in the vicinity of the yacht club last week Monday. Sorry. So it's like, wow. And these mosquitoes get in our homes, and I've seen some sometimes even in my shower. And I'm thinking, where are they? Kevin, you mentioned when you shared this photo, 100 to 200 bites per minute. That's a lot.
It really, really is. And so the weekend before that, I went out in the field with the teams, and we were in the Barkers areas, doing some studies to, one of the things that a lot of people don't really realize about the Cayman Islands Mosquito Control Research and Control Unit is the research element that's in there. Research is a big part of what we do. And so we have a team of researchers that is always identifying the types of mosquitoes that are out there. We have a lot of mosquitoes in Cayman that does not target humans. They don't go after humans. They don't bite humans at all. There's a percentage of them that do, and they're very, very vicious, and they will eat us alive. So before we really do our control element of it, they're out there taking in the data from different points. It's going to be from the trap network that we have throughout the Cayman Islands. It is from our disease prevention officers going into yards as well as into the swamps to identify what's going on, and the activity there is also receiving public complaints. So when people email mrcu@gov.ky and let us know that they might be having an issue, we're taking that data, we're taking all of these different data points to again then respond to whatever is going on out there. So it's very, very essential for the researchers to be out there to also ensure that the different products that we use is also remaining effective. Mosquitoes are very smart insects. They're very smart creatures. And so they are able to potentially become resistant to some of the products, and still we have to make sure that does not happen. So that's one of the things that we're also researching constantly to ensure that's not occurring. Another thing that we also have to make sure is that the mosquitoes are, we're targeting the areas that we really need to target, that we're not just spraying our products throughout the entire island when there's a part that might not be impacted. So they're always taking every bit of effort to ensure that we're doing it for the right areas. And that's why that data is very essential.
Very good. All right. So, Kevin, I know that you have a very active social media page. Is that the best place for people to go to get information on your, your control mechanisms that you have ongoing, and as well just some general public education?
Yes, we absolutely ask everyone to follow us on our YouTube pages, as well as all of our different social media platforms. We're on Facebook, we're on Instagram, we're on LinkedIn, we're on TikTok. We're in pretty much all of the social media sites that are out there. We ask you just to search for Cayman Islands Mosquito Research and Control, and then to follow us. We also have a refreshed website where it's just gov.ky/MRCU. And we have a lot of really great information on our website as well. And then we also have an app that we recently pushed out where people could also let us know if they're having a mosquito issue at their home or place of work, at a location. They're able to download the Cayman Mosquito app, and then just drop a pin to where you are experiencing that issue, and then we'll get a notification explaining that this is the area, and then they could use that. We'll use that data to do some additional surveillance to carry out our operations. It also serves as a notification app where when we have scheduled operations for that day, we are able to again let you know by pushing out a push notification to let you know we're going to have an aerial treatment in this area this evening, or a ground fogging operation in this area for our control efforts.
Fantastic. All right. Well, Kevin, thank you so much for jumping on here with us and giving us some reassurance, really, because I think this is what it comes down to, that MRCU is very well aware of the problem. They're on top of things, and, we have to do our part. And I think you've got a little video for us that you're going to play as well. But, we've got to do our part, but they're definitely doing their part also.
Yes, and so on that video, this is just showing when I went out in the field the weekend before. You saw the picture with some of our researchers carrying out some tests in the Barkers area, and of course I was eaten alive out there. Yeah, it just shows that this is what the hard workers in the background are doing to keep mosquito numbers as low as possible. Remember, we've shared in the past, and for some people that might not have heard that interview, but the Cayman Islands over in Bordentown does hold the world record for the amount of mosquitoes caught in an overnight trap. That's almost 800,000 mosquitoes. Those were the days that mosquitoes used to smother our cattle. And we've come a very long way. And there are going to be moments where we see these spikes that come up. So occasionally you'll see me put out a release, a public notification letting people know, hey, we're seeing a lot of extra larvae activity, and we're predicting that we're going to have an increase in activity. We're on it. Our crews are going to be working, whether it's a public holiday, a weekend, to try to bring those numbers down. It's not instant. So even though we might be going out there and carrying out a lot of operations, it does not just happen instantly. It might take a few days for us to bring those numbers down. But trust and believe, I could tell you the teams are always hard at work in the background, gathering the data to make that data-driven decisions to bring those numbers down. And then, so this is the video here of when I was in the field. I know the radio listeners there's no words to it, but there's a little bit of music behind it. So I'll go ahead and play that. And for those who are watching, have a look at some of the conditions our teams have to go through.
Kevin, I got to tell you the truth. I wanted to start like slapping myself when I saw those pictures. Oh my God, those are a lot of mosquitoes. And it almost makes me like itchy when I even see them, right? I'm starting to think now, oh my God, did one just bite me? Of course, it's psychological. I know there's none in the studio right now, Although occasionally I find one in here and I'm like, what are you doing in here? So yeah, wow, I could see them on his neck and on his face. And you guys can pay me any amount of money to do that job. I'm sorry.
It was not a pleasant experience, but at the same time, I am really glad that I personally experienced it, because it shows me what goes on behind the scenes. And people, we got a lot of people occasionally reaching out to us complaining, oh, the mosquitoes are bad. I'm like, oh, darling, you don't really know what bad is. But we understand. One is too many bites sometimes, and we're going to do our best to keep you from being bitten. Again, when it comes to the mosquito, the Aedes aegypti mosquito that Chris had mentioned earlier, which is the one that carries diseases. So the ones that in the swamps, those ones, they're not going to actually cause any type of disease transmission to humans. It can to pets. The heartworm is one of those that can be transmitted from that type of mosquito to our furry friends at home. But the ones that are born at home is the Aedes aegypti. And again, that one, like Chris said, does not travel very far. And it's likely born at your home or your next door neighbor's home. It does not have a long distance that it travels. And those ones, they're ones that, from what I understand, Chris, correct me if I'm wrong, but they also are more stealthy. They don't buzz like the swamp mosquitoes. And so they tend to be ones that will sneak up on you. You feel them before you see them in most situations. And unfortunately, those are the ones that could potentially carry things like dengue, chikungunya, and malaria. So one of the things as well is that we have a lot of international travel here in the Cayman Islands. We have people going to Jamaica, to Belize, to Honduras, where we know the number of dengue cases is pretty high as for the last couple of years. And so we could have a mosquito that bits, someone had dengue from one of those countries. They come here and then get bitten by one of our Aedes aegypti mosquitoes, and then that bites someone who doesn't have it, and that's how it transmits to someone else. So we have to, always be very on top of things. We have a great close working relationship with public health, where if public health again identifies a case where someone tests positive for dengue, we are going to have our teams go out there and carry out additional treatments around the area that they live in. So again, the chance of that spreading to others, of course, the public health has given them the person with that a lot of education on the do's and don'ts. So they're again part of the response. They're responsible for reducing the risk on their end. We're responsible for adding an extra layer of reduction. So we have a low chance of keeping it out of Cayman. And so far, thank goodness, knocking on wood, we have not had this situation in the Cayman Islands like our regional partners. But at the same time, we have to stay alert, because that can change day by day. We have to stay on it, and we have to respond as quickly as possible.
Absolutely. We do have a caller in the line. Good morning, caller. Welcome to the program.
Good morning, Sandy.
Morning there.
Could you ask him when they go out on their inspection to actually check homes? Because I've been to a lot of homes where I see the washing machine water is led to a area and it gets stagnant, and also water from the bathrooms and from kitchens. So I guess when they go, when they document those, they let public health ask these folks to correct that, because a lot of time the water from the kitchen and from washing machine is not sent towards the sewer.
And I want to thank that caller for bringing that to our attention, but it is something that we actually are doing on a daily basis. Right now, I think our teams are in the northward area doing those exact inspections. We go neighborhood by neighborhood, and we actually carry out what we call domestic control. And so that's where our teams are out there in the field, going into people's homes, again, doing exactly what that caller said. Anytime we see anything that needs attention, we will take care of it. Remember, we're also doing this at a time when many people are at work because it's during the daytime these activities take place. So some people might not know that we have been to their yards carrying out this inspection, so they mightn't see us. There are people at home, and we again, if they are home and we see an issue, we will then have our teams communicate with that person and explain, this is the situation. And in the near future, I am working on some other public educational materials that when they go to a home, that they will leave to let people know, hey, we have been here. This is what we found, or you're doing an excellent job. That's not quite ready yet, but that is something that I am working toward, just to, again, make sure people are having that public education. Chris, do you want to add anything to that?
Sure. I was just going to add, so in 2024, I think we inspected around 35,000 homes. Yeah, and some of those are multiple inspections, but I want to take this time to recognize our team that's out doing these inspections. This is not easy work, so that some days they go to do swamp inspections, some days they're doing home inspections, and they're going yard to yard, walking through the yard, looking for those containers, treating areas that have mosquito larvae in it, emptying containers when they have the opportunity, because that's the best way to eliminate the problem, and then also educating homeowners on what they can do, to eliminate the problems themselves. We find a lot of dogs when we're doing home inspections, so sometimes we have to be aware of dogs in the yards and stuff like that. So we have an amazing team that go out every day, and this is what they do, and just wanted to recognize them.
Yeah, absolutely. We have a question here from another listener to the program. It says, please ask your guests from MRCU, what power does MRCU have to force people to clean up their yards, to remove garbage and other items that can hold water?
Yeah, so we are not the mosquito police. One of the things is we really want to work on ensuring that we build a relationship with our residents, and we can do our best to educate. I do know that the Department of Environmental Health does have some enforcement powers, but again, it's not about being a bully just because there may be some legislative backing to to go in and be the ones that come in and say, oh, you have to do this, or we're going to do X, Y, and Z. Our most important thing is to provide that bit of education. If there is a constant issue and then it has to be escalated, we'll have to take those case by case and then handle it that way. But again, we're not out there to be the bullies. We just want to make sure we're encouraging people to do their part, because again, it's very essential that we do exactly that.
All right, fantastic. Kevin, thank you so much. Yes. Mr. Chris, thank you for joining us today as well.
Yeah, thank you for having us.
Yep, and just want to add one last thing. Anyone, if they're having an area where they're feeling a lot of extra mosquito bites, we encourage you to just email us at mrcu@gov.ky, or just visit our website. There's going to be a quick link on there to download the app, and you can notify us that way, as well as get notifications at home. It's just gov.ky/MRCU. It's right there on the homepage. We encourage everyone to please do that. We also have a WhatsApp channel, which you could also get from our website as well too.
Fantastic. All right, that's Kevin and Mr. Chris there from the Mosquito Research and Control Unit, known as MRCU, dedicated to protecting the health and well-being of the Cayman Islands by reducing the mosquito population. All right, great job. Thank you, guys. I appreciate it.
Thank you so much.
All right, folks. 9:02 studio check, time check, I should say. Let's go ahead and take a quick commercial break, and then we're going to come back and have some open mic opportunity and talk about a number of different things.
For the past 58 years, CUC has strived to be more than just an electricity provider. We have sought to be a foundational company. We give back to our community, and with the hard work and dedication of our employees, we have built and maintained one of the safest and most reliable electricity grids in the region. As we all look to the future, we at CUC want the Grand Cayman community to have confidence that our commitment to you will continue. Join us as we continue this journey together at empoweringcayman.com.
Great news, K-Man! Tim Hortons is finally open and ready to serve you. Start your day right with our delicious all-day breakfast or grab a box of our famous Timbits and a dozen donuts for a sweet treat. Need a quick pick-me-up? Swing by our drive-thru for your favorite espresso drink anytime. We're open weekdays from 5 a.m. and 6 a.m. on the weekends, closing 9 p.m. and 10 p.m. on Fridays and Saturdays, with 2 entrances at the Shamrock Road Roundabout in Red Bay. It's time for Tim's.
Crichton Properties is one of Cayman's most trusted real estate companies for over 50 years. We offer a diverse selection of property listings and help our clients navigate the world of buying or selling their properties with confidence. Crichton is a name you can trust with our excellent customer service and family-friendly touch. Contact us today to list your home, land, or condo for sale by calling 949-5250 or email info@crichtonproperties.com.
Recover Personal Injury Attorneys, helping injured people get what they deserve. Did you know that insurance companies have lawyers that represent their interests? Before signing and accepting any settlement, know your rights. Call us today for a free consultation at 924-9999. That's 924-9999. Recover. Your personal injury attorneys are on standby to assist.
In the mornings, no one wants to miss listening to the Cold Hard Truth or reading CMR. Cayman's #1 news platform has made your morning commute fun again. Pass this time with the Cold Hard Truth on weekdays from 7:30 a.m. Talk radio that's engaging, entertaining, and enlightening. But be careful. Some mornings it's so hot, you might run into a bit of trouble.
All right, folks. Welcome back. Welcome back. Hope that you guys are having a fantastic Tuesday. Yes, it's a beautiful day in paradise. What can we say? All right, so lots going on in the news. I was reading some of the international news headlines earlier. Our President Trump has started a tour of the Middle East, so that's going to no doubt be interesting. Lots of talk over some, private jet that he's supposed to be getting and using as Air Force One from the Qatar government. We have the P. Diddy trial that has started. All of P. Diddy's dirt, folks, is coming out during the trial. Someone sent me a sort of a summary clip. They said, you got to listen to this. I haven't had a chance to listen to it yet, but I've definitely read some of the news headlines as it relates to Cassie, his former girlfriend, who really is the person who kicked this off. It was her, lawsuit that sort of brought things to a head, because in her set of legal documents, she exposed a lot when she sued him, and he didn't get ahead of it quick enough. And so, of course, although he then settled with her so that her particular case wouldn't move forward, as they say, the floodgates were already open. And man, oh man, oh man, oh man, oh man, can I tell you, the floodgates, wow, this guy has some really sick fetishes. If we thought the baby oil was the worst of it, we are now seeing that this guy was abusing these women. He was having day-long freak-offs, as they're referred to. And it's just a level of control and abuse that these women were actually going through. So pretty crazy. And as we'll find out, it wasn't just women, it was men as well. The U.S. is continuing to have a measles spread. They're now saying that it's going to become endemic in the U.S. if this surge continues. So that's something that the health officials are watching very, very closely. Chikungunya still out there. Speaking of mosquitoes, especially for older travelers, that continues to be a risk. So make sure that you are ever so cautious, depending on where it is that you're traveling to. And yesterday was International Nurses Day. My apologies for the oversight and not saying a special greeting to all of the nurses who are just amazing. I mean, listen, if you've ever had to have a loved one or yourself go to the hospital or be sick, you know the phenomenal support that nurses offer to patients and the physicians as well. Like, the physicians wouldn't be able to do what they do without the support of nurses, right? So big shout out to all of the amazing nurses that really contribute in such a positive way to make our lives as amazing as they are when we need medical intervention. And a big shout out now, family. We have Maria, who just recently graduated University of Tampa and her master's in nursing. So congrats to her. And this is such an amazing milestone for her personally, and of course for the larger family as well. So lots of headlines, and let's have a look, of course, at some of the things that are happening right here at home in our little borders, beautiful Cayman Islands. So a couple of things regionally also. We did mention yesterday morning that Mr. Ernie Scott, who's a former district commissioner of Cayman Brac, passed away. Again, we wish to extend our condolences to his family. He was 69 years old, and his public service started all the way back in 1973. That was the year that I was born. Oh my gosh, that's a long time ago. And so, spanned an extraordinary 48 years. This is a testament to who he was, and I've heard nothing but wonderful things about Mr. Ernie, and we were very, very sad to have heard of his passing yesterday. Was very involved in the Cayman Brac community and the larger Cayman Islands community as well. When he retired a few years back, people were able to talk about the contributions that he had made. Of course, MP at the time, Moses Kirkernel, spoke about it. Ms. Juliana O'Connor-Conley also made some remarks and just acknowledged the fact that he has made amazing contributions and leaves behind quite a legacy of service, integrity, and community spirit that's going to inspire a lot of people, especially on the sister islands for generations to come. So again, we express our condolences to Mr. Ernie Scott's family. Additionally, we have a number of regional stories that were really trending yesterday. I think it was just yesterday as well, earlier in the day, that Renee had done a story on another unfortunate death in Jamaica of a young child, a 9-year-old child. These are the stories that really pull at my heartstring. This little girl, she's 9, but she's a petite 9, poor little baby, was unfortunately sexually assaulted in her home in Spanish Town, St. Catherine, on Friday evening. And they had a man wanted for the gruesome crime, and he also murdered her after sexually assaulting her. So this guy, they called him Cooley. His proper name was, let me see if I can find his proper name now. Listen, it doesn't even matter. I don't even want to say his name because, we're not going to give him any accolades. Giovanni Ellis, there you go. But he got in a gunfight with the authorities yesterday, and they shot and killed him. I say good for them. I don't feel any way about it. I'm going to be honest with you. I think that's what all rapists and definitely child molesters should be subjected to. So kudos for the JCF taking out an undesirable individual. And so it is what it is. I see that their Prime Minister, Mr. What's his name again? Anyway, he was making some comments that after this, like he met with the family, and he's making some comments that, he wanted to revise the legislation around sexual offenses. I'm like, really? Revise it again? Y'all need to step it up and make sure the legislation it has no holes in it, and it speaks volumes to what needs to be done when it comes to people like this. As far as I'm concerned, they should not see the light of day ever again. The photos of this man was trending. There were some media houses that showed the full photo of his dead body. I know people in Cayman tend to be very, very sensitive. Sometimes we get phone calls. Even last week, I received one that said, "Oh, this photo or this video, we can see the person off in the distance." Every media house has to make these decisions. We used the photo of his face covered, and you could obviously still see that he was deceased, but it had his face covered because his face was not a pretty sight if you saw the uncovered photo. And so, we try to be somewhere in the middle with a lot of those types of things. But yes, he was killed by the authorities, and even his own mother. Did you guys hear the voice note where his own mother was saying that she thought that he should be taken out? And I can't not agree with her. Let me put it that way. So there are monsters, unfortunately, amongst us, and he apparently was one of those. And his mother said in a shocking interview, which I'll post online in case you guys are interested, but she basically said that he deserved to be killed. So, imagine if his mama feels that way. She's probably scared of him herself. If the mother feels that way, I think that might be saying quite a bit. In fact, let me see if I can play the video here for you guys where she makes her comments. But anyway, so that was a sad day when this happened on Friday. It was not a sad day yesterday when he was killed, because like I said, you do something like that, you have demonstrated the kind of person you are. And so, I don't really care about his life. I care about the little girl that he cut her life so short.
Of interest on the run, Giovanni Ellis. His mother, Lurleen Williams, spoke with Rubian Williams today.
If this ever go out to the public, anyway, uno catch him, uno kill him. Anybody at all catch him, kill him.
The police advising against jungle justice.
Really? Me ask the police, they really uno that catch a man like that and carry me for goddamn taxpayers' money? Miss, when me see him, I couldn't recognize him, we and get fat. In a jail in there and get fat, but in their road, fat and look good, so. He might get 3 meals a day, sometimes he even have one for the day.
So you wouldn't want for them to bring him in?
Him no figure in alive, miss. Miss, him no figure in alive. And me give birth to him, and me attack that. Him no figure in alive.
Wow.
Me tell that to the police, them pan them face, and tell them, say, if me face him, me a kill him. Cause me not make him force me and kill me. Cause no him bring me come here, and me bring him come here. And before me make him kill me, me kill him.
On that note, are you fearful of him?
Yes, I am. Even my little son you see here, very fearful. Because we hear a lot of things. Say him have gun, him have all kinds of, we're fearful of that because we not have none, and we not have nobody for back with that way there. Yeah, we only have to depend on the police. Yeah, we're fearful because with knife and machete, we can't face gun with knife and machete. Because we still...
Wow. Yeah.
A mother.
Yeah.
And when you hear that from a mother, you know how bad it is.
That's right. Wow. All right. What can I say except, mother knows best in this case, obviously. Erilyn Jean Thompson, your card has been found. Your debit card has been found. Please shoot us a quick message and we'll tell you how you can correct that. Mr. George Fullerton says, yes, the Georgetown nurses are the best. Given his character, says Voyager, I'm surprised he wasn't here in Cayman and found some local idiot to keep him here. As Lucille says, put on a kaboom. For that mother. And I understand from another source here on WhatsApp that apparently this was not the only child that he had raped and sexually molested. No surprise there, because you'll find that a lot of these offenders are repeat offenders. This isn't a one-off situation, folks. So absolutely disgusting. It just makes my stomach upset even thinking about it. So George says, careful, his friend don't come for her. No, honey child. I'm not so sure that she has to worry about that. Joanna says the Prime Minister's name is Patterson. No, it's not. It is, hold on, let me tell you. I forget his name. Jamaica. His name is Andrew Holiness. There we go. Andrew Holiness is the Prime Minister of Jamaica, folks. Yes, so he actually was in the news recently about some doctoral program or degree that he had. Northeastern universities helping Jamaica's Prime Minister tackle gun violence. Well, he's going to need all the help he can get, honey child. It's a very, very serious problem there, without a doubt. So thank you so much. Andrew Holiness. Thank you, Al Ray. Yes, Miss Beulah, Miss Joyce Sand. Thank you, the Honorable. Is he Honorable? I don't know how they do their titles there, but I'm assuming. Isle says, can you talk about that post you made that had a lot of activity? The one about the mixed pit bulls, the comments were very worrying. Going forward, can you consider handling that differently? Well, I actually haven't seen the post, so I don't know what you're talking about. I keep telling you guys that when it comes to social media, it's a lot. And so I have someone who handles probably 99% of the social media stuff. She's actually going on maternity leave, so I need to get my fillers in, but I haven't seen it. I don't know what the discussion was about. I don't know what the post was about. There are literally days that I don't have time to go on CMR's Facebook or Instagram pages to read anything, because I am, let me show you my to-do list for today. Can y'all see? It's long. That's yeah. It's a long to-do list, and that's only part of what I need to try to accomplish today, honey chill. It's a lot of stuff, okay? So there's a lot of moving elements to what you see here on CMR, and there's a lot of stuff that I need to do. So I don't know. I don't even know what it's about. I have no clue what the controversy. You're saying the comments geared towards taking them for the wrong reasons, and I'm very worried. People looking to get rid of dogs should be directed to the appropriate charities. Was that the picture with the puppies? What I do know is actually one of the local charities did reach out about taking those puppies, and so we have put that person in contact with the owner. And so I do think that that is the best way. And listen, if you're going to, if you're interested in getting a puppy or getting a pet, number one, you have to know that's like having another child. It's a serious obligation. It requires, a degree of love and commitment on your part. It's going to cost you money. These dogs are not free. You've got vet bills, you've got vaccinations, annual checkups, teeth cleaning. Every time Zeus goes to the groomers, he's got to get his teeth brushed and, his bum, shaved and whatever else they do to it and all these kind of things. So it's a real commitment. It costs money. Okay. And they need time. They need, sometimes he's sitting here looking at me like, where are you going again? Miss Stacy's like, they're leaving you home again. He wants to go out places. He wants to see stuff. He wants to do stuff. So you've got to have time for dogs. And I think a lot of people get them for the companionship that they offer, but don't realize that they also have to be responsible and have to also give them companionship and make sure they're getting exercise, and different breeds are different. And, Zeus is small enough, he can run around the house, but even when we put him outside, it's like a totally different dog. He gets what we call the zoomies, where he's like zooming all over the place, running from one side of the yard to the next. And it's great that we have the yard space and we have it fenced in so that he can, get some of that excess energy off. And he is a fast little runner, honey child. Let me tell you something. You see them little feet going, you're like, wow, that little dog can run so fast. Yes. And those little dogs, they love the outdoors. They love getting muddy and dirty and running up and down. And then you got to give them a bath afterwards. That is so much fun for them. You have to see him on the pickleball court whenever I play. He gets to have some outdoor time. And honey child, he is just his happiest when he's outside. In fact, there are times that he just wants to go and sit on the porch. We have a patio area. That dog just wants to go sit out there and do nothing else. He loves being outdoors. And so, that's what you should do. You should allow your pets outdoor time supervised so that they don't get into any trouble. I'm going to show you all a picture, Zeus, here at the pickleball court on Sunday when we played a week ago. He was out there living his best life, child. But this is what they do, and this is what makes him happy. You can see he's a totally different dog. Look at him sitting right there like he's going to play referee. He's looking over on my opponent's side, calling the score. But this is what sometimes I have to run him off the court because he gets in the middle of the court. And I'm like, Zeus, come off the court. What are you doing over here? You're going to get hit with the ball. He has his own pickleball that he was allowed to get one blue one because that was the wrong size for outdoor play. So I gave one to him and he likes to chew on it and stuff. But yeah, he has a little football. This dog likes to play football. I'm not joking with you. He has a football. And he likes when kids are here and they chase him for the ball and he runs around and tries not to give them the ball. And you'll see him come and put the ball down at your foot. Like, okay, here you go. Throw it now so I can run and get it. You have to know what you're getting into with pet ownership, folks. They're not just, something that you feed and give a little bit of water to and that's it. Y'all got to do better. And I expect Caymanians and all people here to do better. Okay. Jim says they do not deserve to die a horrible, slow death due to untreated heartworm. Don't chain or tie them outside. And of course, we know the heartworms come from those same infected mosquitoes. And a lot of you, unfortunately, put your dogs outside. And my God, yes, that is a slow and painful death, and it's horrific. And so every month, as a matter of fact, today Zeus is due for his heart guard. So we give him his monthly. Because it doesn't take much for them to get bitten. They might not be living outside, but they could still get bitten. So even if you have an indoor dog, please ensure that every month you're getting them their heart guard. That costs money. You're giving it to them on a consistent basis. He also does another tablet for flea and tick control so that nothing bites him and gets on him. These are the things that responsible pet owners do. Good morning, caller.
Good morning, Sandra.
Morning.
From talking about pets to talking law,
Yeah.
No.
Yes. Which by the way, let me just put this little tickler out there for our listeners. Mr. Balika calls in on the program all the time. And I do listen to your comments, even up to yesterday. Another lawyer was like, wow, if he teaches a course, I would totally attend it. So many of you are interested in the things that he has to say and his ideas and so forth. And so we are going to be engaging in some serious conversation about getting him on CMR TV so he can have his own program so that you guys can tune into him because, I love the concept of having variety on our platform. So yes, tell me what's on your mind today.
Well, first of all, very quickly, I thank you for mentioning that. And I thank a lot of people who've been very kind to me and said those kinds of things. I mean, all it does really is encourage me to be helpful, to research more, to be more accurate and so on. And really, yes, we have communicated on that and I look forward to see if that is going to work out because it is something that will really be helpful to the public as well. Now, I just wanted to go back a little bit, Sandra, if I may, on your case, and I called in the other day and we spoke a little bit about it. But as usual with these things, as the story starts to sink in, you start to think about the context in which it was made. It takes me back to the old case, the one which was settled. This is the one where you published the story, somebody didn't like it, they went to court and they got an injunction. Now,
yeah, they've all been settled, to be clear. I haven't had one that went beyond, some of them even were like, oh, we're going to take your home, we're going to do this. And then they settle it and they walk away.
Yeah, and normally when they settle, although some people say, oh, it's without prejudice, usually when you settle, it's because you have seen that actually you cannot win the case. You see, think about if that case, the one where you were forced to bring down a story, but I think it was Mr. Justice Kawali. And I remember your argument then was, why are you trying to get me to get this story down? Because it is a true story. It is document backed. I gave opportunities to the people mentioned in the story to comment on it, and they didn't comment. And then in the end, I published the story. So what is your problem with the story?
Yeah.
The judge still say you have to bring it down. There was then an issue, I remember, that I think you said, well, okay, let's go through the story. And if there's anything which is not true, I'm happy to delete it. But they said, no, the whole thing is just a lie, which is total nonsense. Because I mean, the whole thing was the truth, actually. So anyway, you see now, if that case had arisen now, you would raise the what would be the final judgment of the Court of Appeal to say, hey, you can't make me bring down this story. The Court of Appeal has said that you can't do that. Now, even at that time, he shouldn't have done that because this is not new law. They are just declaring what is old law. But what I think, Sandra, is this. You know very well that it is not every case where somebody gets acquitted where there is a cause to sue the government successfully.
Right.
Because government is entitled to act on reasonable suspicion and so on. But as you know very well, there are cases where you have prosecuted somebody maliciously. And I think in this case, there is a plausible case of malicious prosecution. Because one...
And not even on a single case. I'm going to tell you what I've been thinking about, right? It's not even in a single case, but collectively, there is a very strong argument that somebody has a bone to pick with me. Because it is, at this point, it is near impossible in any realm, any alternative universe, it doesn't matter, that there have been this many criminal cases. Let's set aside the civil stuff, which you started talking about, but the criminal cases that have been brought against me, in something like 97% of them were thrown out at the no case submission stage. Now this one reached a conviction stage, and now it's about to be overturned. Anybody, whether they like me, don't like me, whatever, has to pause and think, how is this possible? It begs the question.
You see, you have just taken the words out of my mouth, because there are two levels of malice. One is the one you have explained, which is how there is a pattern of bringing frivolous cases against you. That's one. But I believe that if they investigate this particular one as well, they will find that there are even more specific cases in this case, because I think they need to look at who complained, to whom did they complain, what was the advice given, and how did it wind up in a court of law? Because when the Court of Appeal now has said this was so frivolous, they are not just criticizing the judge, they are criticizing the people who brought the case as well.
Exactly. Okay. Which includes the RCIPS and the DPP's office. Ultimately, the DPP's office.
All of them. And then bring it to the broader thing. And so now I know that you and Mr. Bush don't see eye to eye, but even in his case, at least the one case, one of the cases, it appears that the evidence was weak. And I'm not saying that it happened or it didn't happen, and I don't want to kick a man when he's down and so on. But it does appear that in one case, the people who were being brought as witnesses didn't want to bring the case.
Well, one of the two women.
Yeah, one of the two. One of the two. So it needs an inquiry. Think of also Doctors Express. This was a case where they deliberately raided a business which was legitimate, and they had emails showing, let's use this as an excuse. That is a kind of evidence you will be looking to find in the government. Somebody saying, well, let's get her. I think we can get Sandra this time. That will show malice. So I think that should be explored, the possibility. I know that there are always issues of costs, but I think you should try to seek a settlement of some kind regarding that. Begin a discussion with them when the case comes up. And I think it will also assist not just the public, but it will assist the media houses to know that, you can pay damages if you deliberately use government institutions to come and victimize people. Today, I won't talk about my case. I just
By the way, just a quick question. Is today your birthday? Somebody said they think today's your birthday.
Oh, yes. Today is my birthday. Yesterday's.
You see, there's very little that passes by CMR. So happy birthday.
Me out.
Yes, happy birthday, my dear.
Thanks very much. Today is a special birthday. I'm 70 today. I can't believe
what?
it. Anyway.
You're 70?
Yeah, I'm 70.
Oh my gosh.
1955. That's when I was born. So,
wow.
Well,
that's you look good. I must tell you that I did not imagine that you were anywhere near 70. Wow, fantastic. Happy birthday.
Thank you, very kind. We'll talk again soon. Thank you, ma'am.
All right, my love. Wow, very
Bye-bye.
good. 70 years old. Oh my gosh, we're all getting up there. But yep, happy birthday to Mr. Balika. What a wonderful wonderful age. All right, so I tell you what, some very, very salient points there for sure. It's at some point I feel like they have it coming. I really, really, really do feel like they have it coming. Island Pearl says, question, I know you're busy and trust and believe. I think we can all relate, but just curious, how often do you look at your social media pages to see what has been posted? It depends on how busy I am, Island Pearl, to be quite frank and honest. Some days and a lot of days, quite frankly, not at all. And I'm not looking at the page to see what do we call it? I'm not looking at the page to read the comments. So even if I quickly look at the the posts, right? So let me explain a little bit how it works, because maybe it helps. So every story that is posted on the website ends up getting posted on social media. Those are run-of-the-mill stories. So we have a writing team, and I trust 99% of the time they get that right. There's no sort of issues or questions there. If there's an element of the story that's wrong, then obviously it is quickly fixed. Beyond that, and most stories are not necessarily very controversial. Beyond the stories on the website, we do get a lot of it's just a sharing of news from other sources. So for example, anytime you see the stuff about Trump, that's a team member sharing the news. Now, there's some people who've taken a very interesting position on the Trump stuff. They're like, oh, you guys are only posting negative stuff. We only post whatever's trending for the day. And I hate to tell you, but 99% of what's trending for today, I guess to Trump supporters, they think it's negative. To me, it's just factual. So yesterday there was a post about a group of 49 white South Africans being granted this special type of, he's reinvigorized. That's not the right word I'm looking for, but not reinvented, but revived some special category of refugee status for people who are victims of racial discrimination. And ironically, he has offered that specifically to South Africans. And so Afrikaners is what they're called, apparently. And as someone who just went to South Africa, I do think that this is very, very interesting. And so 49 of them, the first, I guess, inaugural flight, came to the United States of America on a flight yesterday. And so that was news, and it just got reshared. Now, the pro-Trump people sees that as, oh, that's something against him. Oh, you think that makes Trump look bad? Oh, really? I mean, it's a fact. So how are we making something factual make him look bad? I'm a little bit confused about that. I'm going to tell you the truth. If we're just reporting the facts, then what's the problem? Okay. And then there's other stuff that gets posted, which is people sharing things like lost and found, the dogs, like, okay, we found these dogs, the traffic alerts, the traffic accidents. So most people, it depends on how those things come through to us. There are times that they are coming directly to me, and then I'll just forward it. So every time I get found phone, found this, whatever, the vast majority of those get forwarded to the social media manager, if you will, if I can use that term. But she's the one who's reading the social media messages. So there are times when she will say, and in her discretion, you need to reach out to Miss Sandy about this. This is something that I can't just post. It has to be a further conversation. And so there are people who think, when they message me that they are talking directly to me, and you're actually not, right? The vast, vast majority of the time, it's not me on social media at all. So let me just I'll show you guys a quick example of this. If you want to reach me, you just WhatsApp me. That's how you know it's me, when you WhatsApp me my 324 number. And I control the WhatsApp, so nobody else controls the WhatsApp messages but me. even on the show phone, which I am always forgetting to check, to be honest, because I got too many phones. All right, but here's Miss Marla Ducaran. She sent a nice message saying, congratulations, Miss Sandra. I'm happy to see you cleared, if not vindicated. Sometimes things seem so unfair, and they are really, but God is doing his work, and we have to trust that he knows best and why he's doing what he's doing. Sometimes I wonder if it's to give us strength, to make us better people, to make us more compassionate towards others who are suffering, to teach us specific lessons. But whatever the reasons, we are here on earth to make it a better place somehow. So we must learn and grow from whatever challenges we face. And I can see that you have grown, and I wish you continued strength and growth and blessings. And so you can see here that the social media manager says, thank you, Miss Marla. Miss Sandy is mostly available on WhatsApp, but I'll pass on this beautiful message to her in her direct number. And then she says, how she can directly reach me as well. By the way, Miss Marla, thank you so much for this amazing message. So she will forward me messages like this and just give me a heads up that amazing comment came in. But I leave it up to her. So what is being talked about this morning about the dog cases and stuff like that, if I just sat here and stuck to the stuff on social media, I can tell you that I would never get anything else done, because social media is very time consuming. I had someone say to me, oh, can you go back to post and take down a comment that I made? You know how difficult it is when you have, let me just show you guys this, because I don't think you guys appreciate what is even involved in just managing the social media component. But I'll show you the page here. Just managing a page. When this post about the dogs, I'm seeing it now, has 122 comments, right? For me to go through 122 comments is like pretty wild and crazy, right? I don't have the time for that. And on average, we get more engagement and comments on social media. This one had 51. This was yesterday's show, 180. We get more engagement and more comments than anybody else, especially news here in Cayman. So it can be overwhelming, and it can be a lot. And sometimes when people ask us to go and look for a specific comment, it's an impossible task. It is much easier for you, the person who made the comment, probably, to find it than us, who have literally in a day, it's possible to have 1,000 comments when the day is done, right? It's hard for us to find your comment amongst all of those. So that's why I tell people, like, you can go back and you can click on the page and see how you've engaged with it and remove your comments that way. This one had 91 comments. It's just a lot. It's near impossible. So we obviously do a lot of lost and found. We have our community page, but we still find that on the primary page, a lot of people are looking there for content. And so we normally put it here and on the community page. So here's somebody who lost an Audi key. Hopefully the owner has come forward. And sometimes people wait until a month later. Oh, I heard that my phone or my passport was posted. We're like, really? It is hard and challenging for us to go back a week, and even worse, a month, to try to figure out who sent that message and where it was sent and where your passport is and all this kind of stuff. So it is very, very, this one had 102. It is very, very challenging. So big shout out, by the way, to Darren McLean. We're trying to get him on the show. Well done, young man. So incredibly happy for you. Captain, put some respect to the man's name, Sandy. Captain Darren McLean with the RCIPS, first Caymanian helicopter pilot. So nice. Here's another one, 141 comments. I mean, you guys are all over the comment section. So I don't think that it is something that reasonably you can expect that we're going to be able to vet a lot of the comments. You guys are supposed to be adults. And so, we allow you to make your comments, and I hope you're behaving in the comment section. But yeah, I don't have time you know, even like I said, even if I saw that dog post, which when he said what it was, and I was like, okay, I remember seeing the dog post, but I didn't read what the caption was or anything like that. I'm thinking, okay, these are just some dogs, I'm sure, looking for a good home. So I just do not have the time to go that deep into it, you know? So it is what it is, folks. You guys have got to behave yourselves is the best advice I can give you. And then even the website stories, the vast majority of those, I'm not the one who's writing them. You know, we've gotten to the point, CMR, small but mighty. So we have a small team. And so I am responsible for the team. And so now I am doing higher level things that have to be done. Right? I'm sitting here structurally working on stuff for CMR TV, meeting with content creators. I'm doing training seminars for them, all sorts of stuff. I'm helping them to become versions of me in their own way, not versions of me, versions of themselves as content creators. And so that is where my focus is right now, CMR TV. Once I get that up and running, then I'm going to be focused on CMR radio, going through the licensing process, all the technical stuff. I keep biting my lip. I have a little thing here where I accidentally keep biting my lip. And then once you bit it once, it gets worse. Oh my goodness, got to put something on that. But yes, so it's, you know, I'm running a business. I hope you guys understand that. And this is not my only business. I do have other businesses. Although CMR has literally taken over my life, I do have other businesses. Speaking of other businesses, I have 2 dash cams left. Anybody needs a dash cam? There are only 2 left. Probably next month, later in the month, I'll put together another order. But if you're dying to get one, and based on some of the stuff I see on social media, y'all need a dash cam. Okay? Trust me. Only 2 left. But anyway, yes. And oh my God, like I said, if I show you my to-do list in a day, like sometimes I feel like I'm just going through a to-do list. That's why I'm going to take Thursday and Friday off because I need a break. Look at this, honey child. This is equipment because I have to be testing equipment. This is stuff that I need to go through. I need to unbox these items, and I need to do some stuff with this, setting up devices, you know, testing devices to see, oh, does this make my life easier? We got AI devices now. Does this make my team's life easier? Sending them out on the road with the best technology and all this kind of stuff. That's there. I've got another bag. Hold on. Let me show y'all. This behind the scenes stuff now. You're getting a sneaky link. All right, look at this. This is another bag of stuff that I need to go through and that I need to test. Again, these are lenses for my iPhone. I've had these literally for years, I'm ashamed to say. And the other day when I was doing my clean out, I was like, you know what? You spend money on this stuff. I've got to start using these things. And I have not yet used them. These are like macro lenses and stuff that I can add to my iPhone to allow the iPhone itself to have additional capability. It's a waste of money if I'm buying this stuff, don't tell Marlon, and I'm not even using it. So I put this on my desk because I'm like, I have got to find time to use all of these gadgets that I'm purchasing. I bought them for a reason, and they help my life if I ever use them. They would allow me to do certain things. So I purposely put this bag on the desk. Here's another one. This is my macro lens kit. And I put this on here to be able to, so this that allows me to do a macro pro lens, 10x 25 millimeter, right? 10x magnification, sharpness and detail, distortion free. And then I also have a 75 millimeter long range macro lens. And these are things that I can use, see there, with the iPhone. And so there's certain things now that I can capture that would be amazing in terms of the content that we're trying to create. Listen, honey child, when I tell you I've had these for years, I'm not kidding you. And I can't get to it because, you know, in the middle of running this business and doing all this other stuff, I'm also a mother. I'm also a wife. I'm someone in the community. Yesterday, I had a request from a new mom who had a baby and she needed some help with her groceries. And so I had to rush by Foster's. You guys know I don't go grocery shopping for myself because I don't have time anymore. But I ran by Foster's and got her a gift card so that her and the baby could have some food, because if she's not eating well, then obviously, hopefully she's breastfeeding. The baby's not going to be doing well, right? These are documents that I'm going through, and I'm putting together stuff to be able to show the designer designs I need him to do for some of the concept and sponsorship stuff that we're working on. This is my little folder. This is stuff that I'm supposed to be doing for Marlon, because you men, certain things y'all just don't do. So documentation and paperwork for him. Poor thing, he's been eligible for his UK passport for the longest time, and we're going to Europe in a few months. And all now, Auntie and I had time to do something for my poor husband. It is a lot. And I'm not complaining, because I just get on with it and I do what I have to do. And at the same time, I'm also helping people, applying for this and that and whatever. So, I do what I can do. And I have long realized, if you want to be a successful business owner, you have got to delegate and allow people to do stuff. That means it's never going to be perfect, even if you do it yourself. But, we do the best that we can do. So thank you for the question, Island Pearl. And hopefully you have a little bit of a better idea in terms of what we do around here. I'm reading reports and doing this. And I wrote a story last, and I'm going to talk to you about that before we end the program, right? Lucky Body says, I'd love to see Caymanian Recipes cooking show on CMR TV. Well, we're going to do a cooking show. It's not going to be all Caymanian recipes, but of course, I would love to see as many as possible. Now, how it's going to be is it's going to be guest people. So I've already tapped into one guy. He does amazing. When I tell you amazing, I mean he does amazing desserts. And so he's going to show us some of those things. We have Anthony Lawson, who's actually an amazing chef. And he's going to do a couple things for us. So we're going to sit down with him. So yes, that's one of the shows that we're definitely going to be launching, is our cooking show. But to make it viable, I've got to find sponsors. I've got to, there's a lot of moving parts to it. So that's coming on board. Most definitely. There's a lot of moving parts. Okay. It's a business. And so it's not as easy as people think. Yeah. I know people think these things are easy. And then I am, involved in the political front, trying to keep y'all updated on what happens there. I'm meeting with some of these people so we can keep the lines of communication open. Because when stuff starts to pop off, you can't have not established a relationship with them and think they're going to talk to you or tell you anything. That's just not how it works. So I'm constantly messaging them, checking in, and doing the most. Let me talk about something that's important. I briefly touched on it last week in relation to Joey Hugh. The story is now up. If you haven't seen it, I was up until 1 o'clock last night actually working on this story so that I could get it up and you guys could have a full explanatory story. You can normally tell when I write something versus when Renee writes it, because I am very verbose. In other words, I got lots of words, lots of chat, and I put that in writing. And so, most people can see when I write something, when I do a case review, whatever, it tends to be much longer, much more detailed, because I don't want to miss anything. Sometimes I'll say to Renee, listen, please read over what I've written, because I might have been copying and pasting it and writing it in real time. And I leave duplicate paragraphs in there because I changed something in a paragraph and then I forgot to take one out. So I need another set of eyes, right? So I'm going to put the link here for the story. Go read this story, because this is a very, very interesting story. Joseph Hugh got some information wrong. I don't know if he intentionally did that or if it was just an error on his part. He's not made a comment about it. He's not corrected it. And I think that's now where he's wrong. And he should correct it, because we've spoken to the governor's office and the governor's office has said something completely different. Having said that, CMR is involved in the mix because this has to do with a document about Chris Saunders that we obtained. Now, I've expressed my opinion that I think that it's shocking that someone like Mr. Saunders will now try to hide behind the data protection law in order to hide his P. Diddy style behavior. Let me just leave it at that. What I think is very, very interesting is the fact that the Ombudsman's office seems to have this opinion that we're a data controller. And I've spoken to lawyers, and I've done some legal research on my own. You guys do know that I have a law degree. And I think that their deputy, this is a deputy, whoever over there, I think that they have completely gotten this wrong. And nothing further could be from the truth than, oh, wow, Kim Kardashian's thing is in court today as well. She arrived in court today, testified against the man allegedly responsible for 2016 robbery in Paris, France. I thought that was over a long time ago. Whoa, that's still going on? That's almost 10 years later. Wow, we thought the judicial system here was slow. Damn. Okay. Anyway, yes, so the you should read the article because I have had to formulate a proper response now to the Ombudsman. And these are the things, this is a part of my job. Let me be very clear. This is the part of my job that I do not like. I don't like the court cases because they take time away from other more important things that I should be doing. Okay. And so, and none of them have been successful. You know, they all come back and say, okay, let's just drop it, whatever. Sometimes I approach them, you ready to drop it? Yeah. Okay. And, you know, so the only successful one on the criminal side has been this one, which hopefully by Friday we'll have the written judgment on. We're hoping by then, because that's when the Court of Appeal actually leaves the jurisdiction. So, it's just one of those things that I find is time consuming in a way that I could think of like a million other things I would rather be doing. You know, that song, I'd rather be, you know, that's like me. But I have formulated a response. I've had to look at the Data Protection Act, at what a data controller is defined as in a legal way. I've looked at territorial application. And I have also looked at the exemptions that apply for journalism here in the Cayman Islands and all over the world. I've had to look at landmark UK cases. So now I have to put all of this in a letter, send this over to the Ombudsman's office, and basically tell them, please tell your children not to be listening right now, because I'm going to tell y'all something. I basically am going to tell them in a very professional and nice way to fuck off. Okay? I would love to just tell them that, but that's not what I'm going to do. I've got a long formulated international standards of media and data protection, practical implications of classifying media as data controllers, application in the present case with Cayman Mall Road, yada, yada, yada. Oh, it's going to sound so lawyer-like and so proper. But what I really want to tell them in my heart of heart is just fuck off. I got more important things to do. Okay? Protecting predators like Chris Saunders is not at the top of my list. And I don't care how creative they get, whether they run to the police and try to use Section 90 of the ICTA law, now they're running under data protection. Fuck off. That's what I want to tell them. But I know I can't tell the Ombudsman's office that. I have to respond in a professional manner. So I drafted it last night. I'm going to review it, look at it again, and then we move on. Those things take a lot of my time, but necessary element of the job. Because on the forefront of this, CMR is always, and has been from day one, I suppose, testing the limits of what's normal in this jurisdiction, not in other places. Because a lot of the stuff that I do in other places, it's like run of the mill. It's no big deal. In Cayman, oh my God, oh, we get our feathers ruffled and oh, Sandy can't say this and she's a bully. Really? Y'all have no, half y'all would not survive in the UK when it comes to media. Pierce Morgan and whatever his name is, and all these people. Listen, they go after everybody. Everybody's fair game. The things that he said about Meghan Markle and this one and that one, they just have to sit there and take it or don't listen. You know, and Cayman, y'all are so soft. And so some people say, to me, oh, Sandy, you know, you've changed and you've grown over the years. I'm not saying that that's not true. But what has really happened is what has really happened is you guys have gotten used to new norm with CMR being around. That requires me testing the waters sometimes. I get it. Pushing the envelope a little bit beyond what your comfort level is. I get that as well. And so be it. We're all going to be fine. And in fact, we're going to be better off for it. Okay? With CMR TV and radio, we're going to elevate things even more in terms of the variety of content that we have. And I need to have control. That's why I'm going to have my own radio station. I ultimately need to have control. I don't like people messaging me and telling me what to do and what not to do. That ain't my style. That's not who I am. So we all have to live within certain legal perimeters. And so the off-right gets to tell me what to do. And that's fine. But I don't want anybody else trying to tell me what to do. Politicians, you can't tell me what to do. And I've had them. I've had some of them call, oh, can you not talk about this? Then no. Sorry for you. But that's not how this works. Okay. All right. Having said that, folks, almost 10 o'clock, 9:58 in the CMR studio. I got work to do. I got a lot to do. I got my to-do list that I better start working on. And I want to take this opportunity to thank all of you who are supportive of the platform and for the questions. Thank you, Isle 2025 and Island Pearl, because these are good questions, because a lot of times, you know, you may not understand what's happening. And I suppose the only way for you to understand is to ask the questions. And I don't mind answering the questions. I'm happy to do so. It's much better than what they do over at CNS, where they sit in and they speculate about things. Even speculating about my financial position, which I do kind of chuckle. I see people trying to guess how much my car costs. They didn't guess it correct. I can tell them that, but that's fine. And, you know, if they would only just listen to CMR and listen to the program, they'll know. How long before I purchased my new car was I not talking about it and saying how I was going to be saving up my money because I knew for my 50th, I was treating myself to a new car. And I also knew, most importantly, before I did that frivolous purchase, because purchasing a new car was completely frivolous. I own it 1,000%. I've said financial goals are important. I can't get there unless I pay off the mortgage on my home. So while these fools out here weren't worrying about me buying a car, they didn't see me hustling and bringing down that mortgage, because that was the bigger goal. And this was the reward at the end of achieving this goal. Okay. When I was in my 20s, I made stupid mistakes with money. I'm a big woman now. So if I want to treat myself and I want to spend my hard-earned money that nobody gives me, I run a business, that's fine. I can do that. You pay your bills first. That's rule number one. And you don't splurge on certain things if you cannot afford it, right? So right now I got some things I need to clear off. I'm waiting on some people to pay me so I can pay some other people. And once that happens, everybody gets paid. That's how it works. I've got financial goals, right? I'm so thankful that I have been hyper-focused on land acquisition, because I remember when I first came back to Cayman, as a younger Caymanian, I should have taken up opportunities, but I didn't know any better. An acre of land in Savannah going for $60,000, and it was owner finance. I should have taken that up. Young Caymanians, you will see things now, you think, oh yeah, it's still overpriced, it's not. That's when you sacrifice not having the new car. When you get to my age, you want to go buy a new car. I'm not going to no bank to borrow for it, mind you. I can save up and pay cash. That you can do that. But get your little piece of land. Get your little house. Okay? People acting like, oh, it's only now that she would see CMR, she making money. Please. This is my third or fourth Mercedes now. Okay? I'm just telling y'all. That's not new. Right? I had an apartment was paying a mortgage from day one. Those are the smarter commitments that you can make. Invest in yourself. Invest in your education. I didn't become a business owner overnight. These are people who are talking pure nonsense, and they don't know that I have been a business owner now for over 20 years. Huh? That makes a difference. You don't arrive overnight. You don't have overnight success. CMR is coming up in 8 years next month. But overall, I've been in business for myself for over 20 years. You can reward yourself when you've worked that hard, when you've made the necessary sacrifices. Now I'm thinking about my future, my daughter's future, ensuring that if she does the right thing in life, because these are the same messages I have to convey to her, that she will be rewarded for doing the right thing. And there's certain expectations that I have of her. And she has to meet those expectations if she wants to be rewarded by me in any meaningful way. Miss Brenda says she needs a new Volvo. Do y'all still like Volvos? Miss Brenda, I don't know. Yes, Damien, you know how much that land is worth now? I kick myself every time. Because back then I was like, who wants to live all the way out there? That's the bushes. And guess where I'm living now? In the country. Ain't not country no more. Working in silence and kaboom. Love it, says Prosperity Purpose. Joanna says, great advice. Listen, I can only give the advice because I've failed and I've been there. And I know what it's like to make the poor decisions. I keep telling young people, you don't have to make the same decisions or the same poor choices that came before you. You can actually learn to make better decisions. You know what I mean? So yeah, Miss Brenda says she might want me to buy it for her. No, girl, we're gonna buy you something else. We're not buying you no Volvo. I don't like Volvos. All right, folks. So let them. This is our 2020 theme. Let them. They're concerned about what I'm doing, concerned about my finances, talking what they don't know. Let them. Let them talk all that they want to. Somebody say they love Volvos. Really? I need to go look at the new ones, but they're kind of too, I don't like the shape of them. I don't like a Volvo. But then again, I haven't been inside a Volvo in a really long time. I don't like the design of the Volvos, but anyway, we'll talk about that later. But yes, let them. They don't know your sacrifice. They don't know your failures. They don't know how you've gotten where you've gotten. So let them talk, because that's all some people are capable of doing. Meanwhile, oh, really? What a hot mess. I just saw that mess. Meanwhile, we are out here about our business. We're focused on that to-do list, which is accomplishing goals every single day, getting closer and closer to bigger goals. And we are going to be, imagine if they're upset and they're in their feelings now. Lord Jesus, what's going to happen to them when they see CMR TV come online? What does MOFB stand for? When they see CMR TV comes online, CMR radio, damn, that little green eye of jealousy is really going to get to them. Poor them. They'll be okay. And I love giving back to my community. You know, that's important as well, because it's not just about me. You've got to get out there and help other people. That ultimately is the mission here. You have to be a success in your own right. And, you know, but then you get out there and you make sure that you're able to help other people to level up. But they got to want the help, and they got to work for it. So MYOFB is acronym for Mind Your Own Fucking Business. Well, part of our platform is we are minding other people's business. So maybe I shouldn't tell anybody else that. But there's certain things that I'm like, listen, if you're not stealing it, if you're not, getting it the wrong way, I don't care. I'm actually happy for you. From one K Mannion to the next, I am happy when Caymanians are successful, when we level up, when you get that house that you want and whatever. None of that really makes you happy if you're not right on the inside, I'm just saying. But I am happy. Level up. And that is what CMR TV and CMR Radio is going to be all about. Giving content creators the opportunity and the skills, because I'm going to be doing training. I was talking to a Filipino group last night. I'm going to train them what equipment they need, how to, do like everything. And they were like, really? Yes. I have to share and impart what I have learned with anybody who wants to listen. I mean, if you don't want to listen, then that's your business. But, help one, and you keep it going. And one help one, and we just keep it going. Thank you so much, Miss Brenda. She says, thank you, San, for all of your blessed, great advice. Thank you for your inspiration, love, and care always. So happy for you and your dear family. God bless you profusely, continuously. Thank you, Miss Brenda. Now, I do have a request. Does anyone have Ms. Valda's phone number in Cayman Brac? I need to reach out to her. So if you have her phone number, I was given one cell phone number, but nobody's answering that number. If you have her number, please WhatsApp me so that I can get it from you. I know sometimes she listens to the program. Ms. Valda, if you're listening, please reach out to me. I have something for you. All right. That's all she wrote. Thank you guys immensely for your continued support. Like I said, we wouldn't be a success really if it wasn't for you guys. Obviously, something here on this platform resonates with the vast majority of people. You can't please everybody, and I've never been a people pleaser. Shocker. So it is what it is. And so many of you have contributed in a lot of meaningful ways to this platform. And I really, really love that. And I love that each one teach one. That's right, girl. And I love that we are a community. Now, let me say this. I saw a comment earlier. Yes, there was two Brendas. So that was Brenda Ebanks. Thank you, Miss Brenda. She says, say which Brenda made the comment. Yes, there's more than one Brenda in the comment this morning. But let me say this. I did see someone earlier, I think it was Mr. Wilton McDonald, say this morning, he was saying good morning to, I forgot how he said it, something about his melanin brothers and sisters. Okay, Mr. Wilton, I don't know how often you listen to the program, but let me give you a little bit of advice. Dr. Wilton McDonald II. I know that he is on a journey of self-discovery about his African roots and so on and so forth. I think that is beautiful and that's fantastic. But here on this program, we are a diverse community of all shades and colors, Caymanians of all shapes and sizes and origins and whatever, okay? So reconsider saying good morning to just a select few brothers and sisters with color in their skin. Hello, honey child. We got white Caymanians. We got Caymanians that are in between. We got high yellow Caymanians, as they want to call themselves, whatever. I don't really care. And we have a massive international group as well. So please extend your morning greetings to everybody here on the platform. I love my foreign friends once they are respectful of Caymanians and our way of life. That's perfectly fine. I love them just like I love my Caymanians. Okay. And so many of them are amazing people. So when I say good morning, I'm saying it collectively. Jamaicans, Filipinos, Caymanians, West Bayers, Georgetowners, Endas, don't make no difference. Good morning to everyone. You guys have a blessed and wonderful day. We'll see you tomorrow morning, Wednesday morning, bright and early.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.